All right, welcome everybody to my presentation. So the app I chose to design is something that's been based off my practice directly. The app is going to be called Update Me, and it's a user-friendly app that offers updates to patients' healthcare praxis. It will be in real time, but it will not be interactive. In order to do this, the healthcare praxis, who are the target users, whether they be friends or family members, will log on and enter a patient-specific password that will be given upon admission to the unit. They will be able to see any updates that have been posted by the nursing staff, and these updates will be erased after 24 hours. The purpose of this is to alleviate the stress that comes with updating family members and friends, especially during times of trauma or when a patient is critically ill. How will it benefit nursing? It will benefit that nurses will be free from the distraction of the constant phone calls that come in. Instead of being at the mercy of the telephone, nurses will be able to update family members on their own time. And in an ideal setting, if this were to be implemented in a facility, it would be mandatory that the bedside nurse updates it at least one time during their shift, and with any critical important changes. Not to say that if a critical situation was going down, providers would still use the telephone to reach to the healthcare praxis. This will also provide a safe medium to share information with the intended audience and make sure that nobody that is asking for updates that shouldn't be getting updates is getting them. So it will maintain patient safety, which is, as we know, very important. The utilization of resources will be mostly mobile roadie. That will be the app builder I choose because of its usability and ability to send push notifications. From my research, the apps that are created are more services, which this is, and having the ability to send push notifications was a big concern because since these updates are only available for 24 hours, it is necessary that these healthcare praxis know when they're getting an update. Archer software is something that I might consider if my IMT or my IMT department didn't have a data encryption specialist who would help make this HIPAA safe. So, because it is always important to remain compliant with the rules and regulations that go along with patient privacy, Archer software is an entity that serves as an alternative for internal use of IMT and helps ensure that you are compliant with the HIPAA rules and regulations. In order to adhere to the user-centered principles that are necessary to app design, there are also important aspects which must be considered. The app must be easy to use, easy to understand, and efficient and free from errors. By being user-centered, it will be designed with the user, friends, and family of the patients in mind. To ensure usability, the app will be easy to download, easy to access, and easy to use. For example, upon downloading the app, you're going to just enter some basic information so the nurses know how to address you, and then you're going to be prompted to enter in that specific PIN that you were giving on admission. Then the PIN number will open an interface which you can receive and request updates. Essentially, it'll be like you emailing with the bedside nurse instead of like actually interactive chatting. While the updates will be posted in real time, you will not have the ability to have know that your nurse is updating via the interface. There'll be a limit of 3 users per PIN number to decrease on the amount of unwanted sharing, and the messages will erase after 24 hours, like I've said, and the PIN will deactivate upon transfer or discharge from the floor. So for evaluation, we're going to start by piloting it in a single ICU for a window of 3 months. At the end of the 3 months, we're going to survey users and nurses, and then at the end of each month, we're also going to do mini surveys that will address how to work out the bugs and how to better make it user friendly if they have any any opinions to offer. We're going to utilize this feedback, and then we're going to make changes and then offer updates as we make these changes within the app. So hopefully you'll see Update Me coming to an app store near you sometime soon.